Am I too old to be having dental implants? Again, a really common question that we get asked, and people think that they're too old to actually get the treatment done. Hi, I'm Dr. Ash, implant surgeon, and I'm here to answer your biggest questions about missing teeth and dental implants. So, here is the shock truth. You can never be too old to have dental implants. That's right, I've placed dental implants on a patient that was 96 years old. They were fit and healthy, they wanted the treatment done, and we went through it quite properly, and it went really well. And to my knowledge, those implants are still in today. Now, here's the crazy thing. You can actually be too young to have dental implants, but not too old. So as you're growing up, your jaw changes, the relationship between your jawbone and your gum also matures over time. So that usually means that putting implants in young patients is a bit of a no-no. Now, you're probably wondering, how young is young? I would say that I would try to avoid or delay placing implants in an adult male until they are at least 25, 26 years old, and a female, maybe 22, 23. But on the other end, you can place an implant in anybody over that age. There is literally no restriction. The only thing with getting a little bit older is sometimes what your general health is like. Is your blood sugar in control? Are you generally fit and well? What medication you're taking? And we need to ensure that those things are not contradicting the kind of treatment that we want to provide. And in most cases, it's absolutely not an issue. So there you have it. There is no such thing as being too old to have dental implants. Too young? Yes, but not too old. I hope that was helpful. Please like and subscribe, and I'll see you on the next video.